Hi, the three medications that I chose for this unit are allopurinol, isoniazid, and tetracycline. So for the first one, the allopurinol is a xanthine oxidase inhibitor. It works by inhibiting the enzyme xanthine oxidase, which plays a key role in the production of uric acid. It's used for hyperuricemia due to chronic gout, chemotherapy, or some blood dyscrasias. It may cause hypersensitivity syndrome, which would be fever, rash, eosinophilia, liver and kidney dysfunction. It could cause GI disturbances, nausea, vomiting, or diarrhea. It could cause drowsiness, headache, vertigo, a granulocytosis, aplastic anemia, bone marrow depression. It can also cause a metallic taste in the mouth. And then when taking longer than 3 years, it could cause cataracts. So for allopurinol, we'll want to monitor for hypersensitivity syndrome, monitor CBC and uric acid levels. We'll make sure that clients drink at least 3 liters of fluid per day. We'll inform them to report any fever, rash, abdominal pain, swelling, or low urine output immediately. We want to report bleeding, easy bruising, or sore throat, and then report any blurred vision and or loss of color acuity. My next medication is isoniazid, which is an anti-tubercular agent. It's for active or latent TB. It works by inhibiting the synthesis of mycolic acids, essential components of the mycobacterial cell wall, leading to bacterial cell death. This medication may cause liver damage, including hepatitis or liver failure. It can cause peripheral neuropathy, numbness, tingling, pain in the hands or feet, which is especially common in clients who have diabetes or alcohol use disorder. It can also cause dizziness, ataxia, seizures, psychotic manifestations, or nausea and vomiting. For this one, we'll want to monitor liver enzymes throughout the therapy. If the IM form contains crystals, we'll need to warm it to room temperature before using. We'll administer pyridoxine or vitamin B6 as prescribed for neuropathy. We'll report any jaundice, abdominal pain, unusual fatigue, numbness or tingling, or pain in the hands and feet. Know that alcohol increases the risk for toxicity and adverse reactions. And then when taking with phentoin, it may cause phentoin toxicity. And then taking with antacids containing aluminum will decrease the absorption. My last medication is tetracycline, which is an antibiotic. It can be used for chlamydia, mycoplasmal infections, rickettsial infections like typhus, syphilis, and gram-negative infections in clients with penicillin allergy, gram-positive infections like tetanus, cholera, anthrax, and then it also treats vulgaris, topical, and oral forms. This one works by inhibiting bacterial protein synthesis. It achieves this by binding to the 30S subunit of bacterial ribosomes, preventing the attachment of aminoacetyl tRNA to the mRNA ribosome complex. This blockage disrupts the process of translation, which halts the production of essential proteins needed for bacterial growth and replication. Tetracycline can cause GI manifestations like nausea, vomiting, diarrhea, and abdominal pain. It can also permanently discolor the teeth of a fetus, the deciduous teeth, after 4 months of gestation, or the permanent teeth in young children under 8. For this medication, we'll want to monitor liver function tests, monitor for skin reactions, monitor lymphadenopathy and facial swelling. We'll give with non-dairy foods if manifestations occur. We do not want to give this medication right before bedtime. We'll want our patient to report any jaundice, abdominal pain, fatigue, any mouth pain or difficulty swallowing, and then any vaginal irritation or discharge. We'll tell our patient to wear protective clothing and sunscreen for sun exposure, and then also make sure that they know that this medication will decrease the effectiveness of oral contraceptives.